My name is Ashley Chopko, and I'm the principal investigator of a 2021 East multi-center trial, Breaking Old Dogma, continuation of enteral feeds up to the time of tracheostomy and peg placement. Malnutrition is a significant problem in the critically ill. However, with busy operating room schedules, we often find that feeds are interrupted repetitively prior to elective surgery. Interruptions are practiced based on the American Society of Anesthesiologists guidelines for fasting intervals for elective surgery. However, these guidelines were not created for critically ill, already intubated patients. Controversy exists due to the theoretical concern for loss of airway and need for reintubation on a full stomach and the consequent aspiration risk. However, multiple retrospective studies have failed to demonstrate any increased risk. It is equally unclear whether the route of feed administration or location of the procedure affects outcomes. We hypothesize that continuing enteral tube feeds in critically ill intubated patients up to the time of both tracheostomy and peg tube placement does not increase the risk of aspiration and may improve overall nutritional status. We also hypothesize that there is no difference in aspiration events between nasogastric and nasoduodenal enteral feeding routes or operations performed in the operating room versus the ICU or GI suite. We will prospectively follow the patients and collect data from the EMR to evaluate their clinical outcomes, including quantitative nutritional benefits and specific indicators for aspiration. Data will be collected from the patient's electronic medical record and entered onto the AAST online data bank data collection tool. Our goal of this study is to determine if continuation of enteral feeds up to the time of trach and/or peg improves nutritional status in the ICU and has no effect on risk of aspiration. We will also use our data to explore the safety and efficacy of route of enteral feeding and location of surgery. We hope that you will join us for our study. Please feel free to reach out to me with any questions that you may have. And thank you so much for your time.